Good afternoon, I'm Sean Yao and this is One News Now. The country is expecting COVID-19 vaccines from Sinovac and the COVAX facility later this month. But as it turns out, no supply agreement with any vaccine manufacturer has been finalized. Mean Los Baños joins us live from Mandaluyong to discuss this further. Hi, Mean. How did vaccine czar Carlito Galvez Jr. explain this?
Yes, Sean, good afternoon. At the Senate hearing on Thursday, vaccine czar Carlito Galvez actually admitted to the senators that until now the country has not yet signed any supply agreement with any vaccine maker. Galvez told senators that they are still finalizing supply agreements with China's Sinovac, US Novavax, and Moderna. Senate Minority Leader Franklin Drilon expressed concern as it could entail uncertainties in the delivery of vaccines. He was worried that the vaccine deals were done based on good relations only. Galvez assured that senators that there is one type of agreement with several manufacturers which will ensure vaccine supply to the country. The vaccines are also confirmed that the arrival of doses from Pfizer and AstraZeneca through the COVAX facility will be delayed. Instead of the second week of February, the shipment has been moved to third week pending several documents. Sean, Secretary Galvez also assured the senators that as soon as the vaccines from the COVAX facility arrived in the country, they will start the inoculation on the third week of February after 2 to 3 days of technical inspection. Sean?
All right, Malacanang earlier announced that the government signed term sheet agreements with 5 pharmaceutical companies. Now, what is the difference between this and the existing supply agreements?
If I'm not mistaken, I think the senators are actually waiting for the supply agreement. It gives a clearer mandate and it makes the deal more sure. Senator Drilon is saying that without the supply agreement being signed by our country, there is actually no assurance that the country will be receiving any dosage or any amount of vaccine from any country or from any manufacturer. So for the senators, Sean, what matters to them is the supply agreement that weighs more than the term agreement. Sean.
All right. So, having said all of that, Mean, can you confirm that the vaccination program cannot start without the supply agreements?
Okay, Sean, it can actually roll out. The vaccination program can roll out on February 23 as soon as the 600,000 Sinovac doses arrive because these doses of vaccines are actually donated from China. So this does not need any documentation or supply agreement. But for those other vaccines that we're getting from other manufacturers, definitely Senators Trilon and Angara and Nancy Binay are saying we should have a supply agreement first before we can be assured that there will be supplies of vaccines that will be coming from Moderna, Pfizer, and other manufacturers. But as for the donated 600,000 Sinovac doses, that is for sure, that the Malacanang is saying will be arriving on February 23. Then the inoculation can start by then, Sean.
All right, thank you for making that clear. That was Mean Los Baños of News 5 joining us live from Mandaluyong City. And the IATF has further increased the venue capacity for religious gatherings in GCQ areas to 50%. Museums, cinemas, and other leisure activities have also been allowed to resume. Let's weigh in on this development with Dr. Ronjean Solante, head of San Lazaro Hospital's Infectious Diseases Department. Good afternoon again, Doc. Thank you for joining us as usual. First of all, what do you think of this move? Do you agree with this? And do you think this is prudent at the moment?
Yeah, thank you, Cheryl, for this opportunity. At this point in time, if you look at the cases that have been for the past 1 month or 2 months, we have plateaued, and in fact, most of the cases now are less than 2,000. And our reproductive number is below 1 already. So I think this is a bit, I agree with the recommendation. And it's just a matter of really looking at specific guidelines when we will be implementing this increase in the capacity, especially for the church and the cinemas. No? And so the bottom line here is that it's still important to wear and obey, be compliant with the minimum health protocol that the government has emphasized. And then at the same time, looking at monitoring individuals in these areas where there will be increase in the number, just the same like the appearance of symptoms and all those that are possibly infected during this type of gathering.
All right, so basically you're of the opinion that everything is okay. We need to learn to live with the virus. So as long as we all, on our own, stick to all these minimum health protocols and the standards that we have been used to, everything will be okay. Yes, Doc?
Yeah, I agree with you, and I think it's also time that looking at how we are, I think we are the only country with the longest lockdown period for now, no? And we have been implementing a lot of these protocols, and I hope we still continue to be compliant with this protocol, the face shield, the face mask, and physical distancing, even with the relaxation of these numbers of people in this particular high risk, possible risk areas.
All right, Malacanang noted that national and local government units have yet to issue complete guidelines on this slightly further reopening of the economy and, resumption of activities. Do you guys have any suggestions, being infectious disease experts, to how we should go about this? Or is the government going in the right direction?
Yes, I think so, because I think the government is really now looking into opening up the economy gradually. And as part of our responsibility as an infectious disease, we still highly recommend more testing for people, especially for those who have contact, and enhance the contact tracing, and including the quarantine facilities, especially if we will be opening up this designated areas. No, so one is still we have to do testing. Second is implement the protocol at the site of this implementation. And third is that we have to, again, enhance our contact tracing and get ready with the quarantine facilities if ever there will be cases in these particular areas.
All right, sir, I just want to get your opinion on the different vaccine brands. Being a medical health practitioner and also working in a hospital in San Lazaro, no less, is there any preferred vaccine brand? How is your staff or the hospital staff when it comes to vaccination? Is there any hesitancy among them or a vaccine brand preference?
Well, we cannot always control, no, that as a personal or personal point of view, there are always people who has what we call their own choice of particular brand of vaccine. But I always emphasize this, no, as long as that vaccine has been approved by our own FDA, being thoroughly reviewed by experts, including the vaccine expert panel, and that is the one that is recommended for the healthcare workers, any brand can be acceptable, and we have to be vaccinated, because the important part here is I think we need to fast track the rollout of this vaccine until such time that until at this point we don't have yet the problem of these new variants. Unlike in other countries now, they're also fast tracking the rolling out of their vaccines. The other problem now is also that they also have these new variants, which in effect can also affect the efficacy of some of these vaccines.
All right, thank you so much, as usual, for your insights and your time, Dr. Ron Jean Solante, head of San Lazaro Hospital's Infectious Diseases Department. Here are other COVID-19 stories from around the world. The U.S. Centers for Disease Control and Prevention, or CDC, says that people who have received complete COVID-19 vaccination can skip quarantine. That is, if they did not have any exposure to a COVID-19 patient. And in the United Kingdom, the head of the country's genetic surveillance program is warning that the variant first found there could undermine the efficacy of vaccines. Sharon Peacock says the more infectious UK variant is likely to, quote, sweep the world in all probability. And the Florida International University has tapped a furry friend to sniff out spaces to make sure they are safe for students and school personnel. The dog, named Wonbetta, is just one of the several four-legged snoopers that the university trained to detect the virus. Meanwhile, medical frontliners at the Lung Center of the Philippines will be among the first to be vaccinated here in the Philippines. Jen Calimon joins us live from Malabon City for the details. Hi, Jen. How are preparations in the Lung Center going so far?
Sean, the Lung Center of the Philippines is now ready for the arrival of COVID-19 vaccines this month. Dr. Novette Francisco, the spokesperson of the hospital, said that they have conducted studies and series of dry runs regarding the proper handling of the vaccines as well as the actual inoculation. Healthcare workers and employees of the hospital will be the first to be injected, being one of the country's COVID-19 referral hospitals. The management has also installed one ultra-low freezers in their pharmacy area near the drop-off area of vaccines. From the delivery van, the shots will be inspected quickly before placing them in the freezer. One ultra-low freezer is more than enough, that's according to Dr. Francisco, since they will only be needing 500 vials for 1,250 hospital staff. The hospital has assigned an indoor function room as the vaccination area. A makeshift emergency room is also put up for urgent matters. Inoculation in the hospital will be done according to priority and in batches of 20s. Hospital staff working in COVID-19 facilities will be vaccinated first. The person will be informed of the benefits and side effects of the vaccines prior to injection. Once vaccinated, they will be observed for 30 minutes to 1 hour for possible adverse effects. The hospital is also ready to assist the person in case side effects are felt a day or more after vaccination. The Lung Center may accommodate the general public only if there's an order from the government and once supplies are enough. Sean, the Lung Center of the Philippines is targeting to vaccinate 250 employees per day so they can finish the vaccination within 5 days. They also assured their patients that their treatment and safety will not be compromised while the hospital is conducting their own vaccination program. Sean?
Thanks for that good news, Jen. That was good to hear. Jen Kalimon of News 5 reporting to us live from Malabon. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao, and we are One News.